Okay, thank you for inviting us along today. My name is Sam Robinson. I'm the Head of Service at Midway Community Healthcare for the Dementia Services. And one of those services is our Dementia Community Crisis Team. I didn't do the original pitch, so apologies. A lot of you, well, all of you, I've never really met before, though I may have spoken to you. Jodie, who is our team lead for the team, is also an admiral nurse. She's actually at the UK Dementia Congress giving another presentation, so I am here today instead. But as I said, I've brought Claire with me. She is my trusted advisor. She will tell me if I'm going wrong at all, because she uses the system a lot more than I do. So just part of our bid, originally was for us to have some funding to be able to purchase, obtain and use the Docobo, which is a telehealth system. The team itself is a very small team. It's made up of registered mental health nurses, as an admiral nurse, general registered nurses and associate practitioners. And they have a very large scope. So they work within Medway, and part of their role is to provide community care for people in crisis. That may be carers, it may be somebody living with dementia. They do an in-reach into care homes, both nursing and residential. And they are also tasked with stopping people being admitted into the acute trust, but also facilitating discharge out of the hospital as well. But the reason we wanted to use Docobo, basically, was to help our care homes. We've been doing a lot of work with our care homes within Medway over the last few years. So, Docobo. Looks like a very big Game Boy. Actually, that isn't the system that we use. We use tablets. So it's the same principle, but if you looked at it off the shelf, it would look like that. It's been around actually for quite a long time. It's been around since 2001. It's been used in different areas of Kent before as well, with some success. And basically what it allows us to do is that remote monitoring of people within the community. It helps with decision making. Also there is a kind of an early warning part of the system as well. So we get alerts through, we can instantly contact a care home and talk to them. And also what we liked the most was that it can be tailored to the service's needs, which is what we wanted. It was an off-the-shelf product that actually the company themselves, Docobo, were really happy to spend time with us tailoring it to what we needed as a service. Claire's nodding at me, so that must be right. So why? Okay, so got the clock up there. What we were finding was, because we have around 57 care homes in Medway, nursing and residential, and actually spread out over a different area, it takes a lot of time to go and visit the care homes. You might only be seeing one patient in one care home, one patient somewhere else. You might be seeing a group of patients. But what we realised is actually for a small team, it's not really an effective use of their time to be driving around Medway, popping in and out of different locations. We wanted to use the system in order to not just support the care home staff, which I'll talk about in a moment, but also to make the team more effective in how they were working. Partnership working, it's already been alluded to today, that actually sometimes engagement with care homes can be quite difficult. They, certainly in Medway, sometimes very notoriously difficult to engage. They are private companies. So actually what we wanted to do was use a system that got them working much better with us in partnership and seeing us as partners rather than a service that comes in, swoops in, tells them what to do and then swoops out again. We wanted to create a more level playing field. We've put skills there, and again it's already been suggested today. We find that the staff in our care homes, the turnover is huge. So we will spend a long time with a care home, getting to know the staff, providing them with knowledge, skills, awareness, whatever it is they might use, and then we go back a month later, those staff have moved on, they've taken their knowledge and skills with them, they haven't necessarily shared them, and we're starting again from scratch. We also find with our care home staff that actually they haven't always had very much knowledge and awareness, so actually everything is quite scary for them. They might be at a really junior level, having to make some decisions, they're not quite sure what to do. So we wanted to provide them with a system that also assured them that they were following the right pattern of care. And last but not least, which really should come first, high quality patient care for all of our patients, wherever they may be. So, very kindly, you gave us funding about a year ago, which was fantastic. That really helped. What we did, so we pitched, we were successful. We then went on to identify 3 care homes who we felt in our local community would be really great to engage with and would work with us on that. We collected a whole load of data around those care homes because we had some very ambitious aims about what it is we were going to prove. We were going to prove that the number of visits reduced, we were going to prove that the number of interventions reduced, etc., etc. So we went through all of that piece of work. Claire and the team then sat down with the team from Docobo, and actually they then arranged all their question sets. So it was the team that decided what questions they wanted to be used as part of a question set within the system. And very much we worked very closely with the Docobo team to do that. One of the things we haven't been able to do was we wanted to put instructional videos on the system, and it has the potential to do that, and we're still looking at that, but we haven't managed to do that so far, just for the fact that the videos we wanted to use, we have to get permission to use them, and it's taken a bit of a time to get through that whole process. We gave each of the care homes a tablet, and what we did as well is actually we asked them to commit to using the system and commit to using the tablet. So they were almost given a kind of this is what we're going to do for you, it's great, this is what we need from you in return. So we put that in place as well. And what happens is the results come back to the team as part of their desktop so they can see what's happening. Team members are then able to interpret the information that they're getting, and it might be really simple questions. So it might be, what time did you go to bed? Did you sleep well? How many hours of sleep did you have? Have you had your breakfast today? All of those kind of different questions, but again, tailored to the individual. And what happens is that a question then kind of sets off another question. So if somebody then says, oh no, I didn't sleep well, it will then go into more questions about why that person perhaps didn't sleep as well as they could have done. And as I've already said, it gives us immediate alerts as well in case there are any emergencies. I'll talk a bit more about that in a minute. So our success to date, engagement, has also been a challenge as well, but has definitely been a success. We are getting more appropriate referrals. What we haven't been able to do is actually quantify that in some way. We have some data that I'll talk to you about in a minute, which will help. Development of question sets has definitely created a better working relationship. Greater efficiency in the ways of working, so actually the team now don't have to go out to every care home. They can see the information and the results that come through the system, and 9 times out of 10 it's just a simple phone call. Looks like you're doing really well, carry on with what you're doing, or these are my suggestions, why don't we try this, I'll come and see you tomorrow, something like that. So it stops that ineffective way of working. Potential problems for people living with dementia are highlighted very quickly and therefore managed effectively as well. I've put what we're expecting to see. We want care home staff to feel more in control. We want them to feel that they can trust the technology that they're using, and we want it to upskill them as well. We hoping that it will result in the reduction in the use of medication, which we know is still an issue for people living with dementia. And I'll chat a bit more about that. And also what we're expecting to see is Docobo used within other teams within the organisation as well. So we've already been approached by our community nursing team, who have advanced care practitioners who are also going in and out of the care homes in our local area, and to learn from us about how we've used it, to actually then implement it in how they're working with the local care homes as well. So I won't read that, but I thought it was nice. Andy, who is the home manager for Grace Manor, is the only home that has been with us since the start of the project. And actually, they've really, really embraced it as well. He's very pro-technology. So we've put that up there because they're the home that are using it. Should say the 3 homes that we identified, 2 of them dropped out within about a month of starting, and there were a variety of reasons why. Some was just actually, it just doesn't work for us. One was just a lack of engagement, really. So Grace Manor have been with us since the beginning, so I thought it was important to show you their comments and how they found the system. And we continue to use the system with them as well. The other 2 homes, what we did was, so as not to delay, we identified 2 other care homes as well, both of which, Claire, you would agree with me, have taken up the use of the system as well, but have been using it for a lot less time than Grace Manor has. Challenges, engagement still remains. I'm very lucky. I sit on a group of people within Medway that work with the care homes, so I'm constantly there saying to them, this is working really well, let's show you how this works, but engagement is still an issue. I've talked about the instructional videos, showing the effectiveness of Docobo. So like I said, we took all this data, and then actually it was really difficult to quantify it. We had lots of qualitative and anecdotal evidence, but actually to put some hard figures, really difficult. But Claire's worked some wonders for me, so you'll have to forgive me, I'm going to read this. So in terms of Grace Manor, who sent this through to us, we were able to tell that 2 patients over the last couple of months, we recommended a change in medication for them, and actually the use of the questions highlighted that this had been done rather than us then having a conversation with them or chasing the GP. So we are able to show that. What we've also noticed is that referrals are more detailed. We used to get very sketchy referrals through, kind of like a very broad brush. We don't know what to do, come and help us. But actually our referrals that are coming through for the 3 care homes that we're using are much more detailed. So when the team are visiting them, they're not having to do so much fact finding. It is about getting in there really, really early and starting to talk about interventional work at a much earlier time. And also as well, from this particular care home, we've had 1 urgent alert, which meant actually we dealt with them immediately, because that's picked up through the system, so we were able to contact them immediately. So what next? We're not giving up. We're going to carry on using the system. There's been lots of talks today about actually how do we make our innovation financially sustainable. Medway Community Healthcare is a social enterprise. We're not an NHS organisation, but we deliver NHS care. And something that actually the organisation is very keen on, especially as part of the NHS 10-year plan and all the changes that are happening, is how we use technology to actually support our services, but also support our patient care and looking after the resources within the community as well. However, I've put similar challenges. So it's just understanding that it does take time. These things need to be thought through properly to actually make them effective. So we did spend a good 2 months, Claire, going backwards and forwards with our question sets to make sure we absolutely had the right ones that we wanted. So I think it's recognising that it does take time to do these kind of things. Partnership working, we continually try to grow on that. I'm a very optimistic person. I've been around for quite a long time, but I'm very optimistic. So for me, that working in partnership is the only way that I can see that we're all going to manage, and especially in this new world of healthcare that we're moving into. Again, continuing to upskill our care home staff. Just because they leave and go elsewhere, hopefully they are also taking that knowledge with them wherever they may go. Patient care, absolutely, that's key. That's a no-brainer, really. But also what I've put down there is the spreading the word. I get very boring at meetings because I constantly talk about things that the team are doing. So constantly to our quarterly Dementia Engagement Forum, I talk about Docobo and how we're doing. But it's that spreading that word and then actually having those conversations with people about, okay, this might not be so relevant for us, but this might be relevant for us. And our advice. take a leap into the unknown. That's our advice, I think, really more than anything. Spread the news we've talked about. Be patient. We're very much sometimes around the quick wins. And quick wins aren't bad, but actually we also need to be doing that longer term viewing, that longer term looking. Never stop learning. We certainly don't stop learning. So for me, I think anybody working in health and social care, or actually any career, that being able to learn new things all the time and not be scared, but take that leap into the unknown is really important. I talked a little while ago about being financially sustainable. So our organisation, hopefully, I have my fingers crossed, have signed up to supporting us in maintaining the use of the system as well. We were supported by our business intelligence team when we first took on the project. And actually they've seen how effective it is, and as I mentioned, our community nursing team are hoping to start using the system as well too. And that's it. There's a couple of things there if you wanted to know a bit more about Docobo, and there's a YouTube clip actually about where they use the system in a care home in Swale, and how it benefited them there as well. Thank you.
I don't know, Claire, do you want to join Sam? Or do a question?
She won't want to.
One of the things that I was just going to quickly ask, which just as on the basis of your last couple of slides there, was what's the actual cost? Is there an ongoing cost to using the system, or is it the purchase of the equipment initially and then there's no charge?
So what we used the £5,000 for was the purchase of the system and the 3 tablets, and also the building of the question sets, because we did that through the organisation. And then what happens is each year we will have a maintenance cost.
Right.
We're still waiting to find out what that's going to be, but we're already starting to talk about our budgets for next year, so we're going to build that into that budget.
Yeah. Okay. And are you optimistic that that's?
I'm always optimistic.
As you said.
Yes.
They'll get it.
Yeah. Yeah.
Yeah, I think it's interesting. It's another kind of equipment-based intervention, but a very different one from the Lulladols one, isn't it? But still requires the buy-in and the commitment of the people to use it. Because it's all very well having that tech there, but if people don't use it or they don't answer the questions, and feedback to you.
Absolutely, and that's the issue that we had with the first 2 original care homes that then pulled out of the project, is that one of them was a bit half-hearted. They wanted to do it, they started doing it, and then they stopped doing it, and so it was just easy to say to them, okay, now is not the right time for you. It doesn't mean to say that we can't introduce it again in the future, but actually we want to show how the system can be used. And the 3 care homes we have now, I've seen one of them using it in action. They love it. They've fully embraced it. In fact, they look forward to getting their tablet out in the morning to put their results in.
It saves so much time.
Yes.
But wasn't there some research done, Sam? Was it the King's Fund who said that there are major issues about the reluctance of current healthcare provision in embracing new technology, because they just fear that there will be mass redundancies, that there is an awful lot of time spent in a car driving between those care homes, whereas you could do so much and on the tablet. And that's going to only increase, isn't it, right the way across the world?
It's also that trust aspect
Yeah.
as well.
Yeah.
We're not selling the importance of the one-to-one and the face-to-face contact. That's still really important. But actually, if you trust in the technology that you're using, then when you do have that face-to-face discussion, it's far more effective, because you're not chasing up what you've been asking them to do for the last couple of weeks.
Absolutely.
It's much less frustrating. And as an organisation, we're going through a bit of a transformation project, so actually this sits quite nicely. And actually, as you said, it's not a huge amount, it's a small amount of money, but it's not a huge amount of money. But we've been able to show where it does make a difference, albeit at the moment still very in that qualitative rather than the quantitative information.
So is alignment with the strategic objectives of the organisation sort of quite a key to the sustainability?
Absolutely, yeah.
And what about in terms of the staff embracing those kind of new technologies? Was there anything that you saw was common in the people who did embrace it versus the people who were perhaps a bit like maybe did it for a few weeks because it was new and shiny, but then it didn't become embedded in their practice?
That's a difficult question, actually. Claire, would you?
I think within the team, because when we sort of first said about it, there was a bit sceptical about what's this tablet going to do. But I think the people who are actually involved within the care homes, they're the ones that have seen it more as the ones who are community-based, because it's not really impacted them as such.
Yeah.
But yeah, I mean, to start with, it was just about the three of us that came from the initial bid. We were like the ones like really gearing it up. The others were going, well, I don't really understand it. What's it going to do? But now, I mean, we've got sort of 3 or 4 of them. Yeah, they're sort of very exciting going out there. We can pull up the graphs, and even if like we've discharged a patient, remove them from the system, as soon as we put them back on, we put all their pre-history on there from their previous patient.
So that saves a hell of a lot of time.
So, and the alerts, I mean, we've set them up with different parameters, and they come through by email. So it's, you know, you don't have to be on the system, you just get an email through to say you've had an alert through for this patient. You can go on and then you can communicate, you know, however it's appropriate by phone or so 8 to 10 minutes or.
And do you find that people trust that, you know, trust that alert, you know, that's...
They can email us back through the system.
Right.
They love it. Yeah, I think if you send them an email to their inbox, because it comes through on this system, and it's that reassurance.
Yes.
If someone's there,
It's official.
Yeah. So there's a couple of things there, isn't there, that link with the other projects about the value of being able to demonstrate the value of what you're doing. So it's almost like you because I remember when you came here, there was a little bit of sort of skepticism. It's like, well, what exactly is it? You know, we couldn't sort of visualise how it worked and what it was. This thing that looked like a Game Boy but wasn't going to be Game Boy. You know, it was all a bit kind of nebulous, I think. So, and as you say, if you trying to persuade other people to adopt that technology, then having something real to show them, a video, you know, of how it works, something tangible, is quite important in the same way that Alison was talking about, Alison was talking about, you know, being able to show people the value of using music as an intervention. So just something there for me about a success factor is about value of a visible kind of presence in terms of evaluation or impact or
Also, what we're hoping is that it has a bit of a knock-on effect. So, Andy obviously has very good contacts with the other care home managers. That network does exist. So, what we're hoping is that actually he'll go there and say, "Do you know what? This works really well for us," and then actually spread that word of mouth.
Are they all MCH?
No, only one of them. No, only one of them is an MCH nursing home. The other 2 completely separate, different organisations. Yes. Yeah.
Okay. But they use the services of the crisis team.
Yes. So the crisis team, anybody in Medway can refer into the crisis team, as long as they have a Medway GP and they have a diagnosis of dementia, or they're going through the tests for that diagnosis.
So the CCGs fund the social enterprise, do
So they commission our services. So for the team, I have a block contract, and as part of that, it very clearly states what we will deliver, and then we have key performance indicators, which are then updated on a monthly basis to show how we're doing and what our activity has been like.
And what's the GP's response?
So, to be fair, we haven't asked the GPs yet. The nursing home that actually is within MCH, which is Darland House Nursing Home, I know their GP very well. So actually we were thinking that we might start that conversation with him. But to be honest, I don't know how much he's been exposed to it either, because the GPs swoop in, they do swoop in and swoop out again. So it may well be that actually they haven't been informed. They might know of the system, but they haven't asked those questions or they haven't been told. But it is something that we plan to do. I get to go to talk to the GPs occasionally as well, and they're always interested in new initiatives.
I'm sure that'd be interesting because it's the same thing. It's the time saving. It's
absolutely.
The nature of the referral is that much more sophisticated because you've got all that back data.
And you could use it for a number of services. I mean, we've talked about community nursing, but you could use it for cardiac services, respiratory services. You know, the abilities there. Yeah, absolutely. Yeah. Because what we found was one of the points where we thought this would be good is that when care homes have an issue, they refer to everybody. They just do a broad brush, and we found that we were going in, our community nursing team were going in, our respiratory team were going in, our mental health team were going in. So actually, one of the aims of this was actually to stop that from happening. And if they trust the technology and we have that relationship with them, and they can see how that's working and how it benefits everybody involved, that's a bit of a no-brainer, really, for them.
I think I visited Grace Manor with Dan.
You may well have done, yes. Yeah, they've been fabulous. Yeah.
So if you were to, so say somebody came to you and said, "Oh, we'd like to try using Docobo or something similar," let's say, what advice would you give them, having been through the process of kind of setting up a project like this yourselves?
I think it would be absolutely.
Do it.
Try, yeah, most definitely. I think what I would say to them then is understand the system, because that's what we spent a lot of time doing. Is spend some time understanding the system and then working out how it will work for you. Because although it can be used with a number of services, you need to. There are differences between the different services. So understanding fully how it would work for them, and then having that conversation about, okay, how are you going to get people to engage with it as well, because that has been one of our biggest challenges, is that engagement.
It's not going to be right first time.
Yeah.
Even months after using it, we're still tweaking it, even sort of down to the timescales of when care homes, because we're finding they weren't sort of completing it one day, we contact them and say, why aren't you completing it? Oh, well, we've run out of time by 12 o'clock because of this and this. So we extended it to 2 o'clock. So each time is a tweak. You don't think you've ever finished it.
Yeah, so it's continual adjustment, micro adjustments. Yeah. And no doubt you'll find that'll continue on and on and on. Any other? No.
Thank you very much.
Thank you.
Very much.
Thank you.
It was very much appreciated to allow us to do something really different, which has been great. So thank you.
Okay, thank you.
Coming in.
Yes, thank you.